Jeremy Irons, English theater and cinema actor, has mentioned to his memories that we all have a time machine in us that transport us to the past or the future. The machine that beams us into the future is called dreams, and the machine that take us back in time is our experiences and memories. And these are an important part of our program today. We want to travel back in the time with memories of a successful, amiable Iranian that he lived in Austria. We are right here with you. Welcome to audience again. Thank you for being with us. We are with Mr. Homayun Sodeifi. I ask him to introduce himself.
Okay, I am Homayun Sodeifi, and I wanted to share my very important memories and experiences from Iran here so that they will not forgotten. So far, I haven't seen anyone talk about it. It is the case that I wanted to come to Austria to study here after graduated from high school. At the time, you had to do 2 years of military service to get your passport. Fortunately, the White Revolution was decided by parliament, the governments, and the Shah or King of Iran. Those who graduated for high school or graduated from university were trained and sent to Iranian villages for 1.5 years. So that they serve people in the villages. I signed up and was accepted into the health service. Then followed a 6-month health training.
Medical training?
Very good, and that was in Farabad barracks near the Jale Square.
Now it's Shohada Square.
Yes.
I
Yes.
asked the regie to show Jale Square or Shohada on the screen. Thank you, regie.
Yeah.
This is the now shot of the square, and
Alright.
the yellow parts show the time that you talk about it.
Yes. Farabad Bataks can also be seen there now. This picture shows some in training and seeming below far left.
Exactly.
After the lessons there, they wanted to spread us all over in Iran in order to pay attention to what is thought. We were told that if we have good grades after we have taken the exams, you can choose the village you like.
You had the right to choose.
Yes, the choice. I took the exam. My grades were not bad. I had heard that those who serve in places with bad weather receive more salary. I said, fine, instead of me taking the north of Iran,
Increase income.
I go to Mashhad, Turbat Jam, where the salary was not bad. So I was assigned to a village near Turbat Jam. Afterwards, we were told to present ourselves to the health service in Mashhad. Right? Mashhad, right? Very right. Very right, yes. Yes. Yes, very right.
Okay, continue.
Yes. I took the train to Mashhad 40 years ago. At that time, there was a railroad line there. I had money for the third class. In each compartment, there were two wooden benches for 4 people each. In each compartment were
True.
8 people.
All right.
I was young, and at night I slept sitting until we arrived in Mashhad. In Mashhad, I presented at Sepah Behdash, or health service. There I was told with which doctor's assistant, and driver I am assigned.
As I remember, each health group, as you told us
Yes,
before,
yes,
consists of
yes.
4 people,
Yes.
2 doctor assistants, doctor, and a driver.
Right. Yeah. Yes. Then they gave us sleeping bags. Afterwards, necessary things to get started. The next day, we left by Land Rover Jeep because at that time the roads in the villages were bad. We drove toward Torbatejam until there the roads were very good, asphalted. Afterward, we drove to our village, where it went uphill and downhill. It was very difficult. The doctor and driver were sitting in front. Me and the other doctor's assistant were sat in the back, and our seats were on the wheel of the car.
Okay, I wanted to suggest that we make a stopover and then
Yes.
go on.
Yes.
Yes, please. Thank you.
Yes, thank you.
Thank you. Dear viewers, our discussion is getting interesting. You were on your way to service place in your Jeep.
Very correct. Me and the other doctor's assistant were sitting on the wheels in Jeep, and our heads always bumped into the ceiling.
Yes, I had this experience during my military service.
Oh, what did we do? We held on the seat with both hands. The doctor and driver enjoyed that they were sitting in the front. Then we arrived at our village where we were assigned to serve.
It should be remembered that these services were not for larger cities and only for faraway villages of our country where the people did not have a doctor at hand. This makes this work more
Yes.
valuable.
Yes, this is a very important. The people in the city had everything: doctors, medicines, pharmacies. But in the villages, there was nothing like this. We arrived when the mayor and showed us our clinic. And where in the clinic is the pharmacy, the doctor's room, the room for injections, the bedroom for the doctor's assistants, and the kitchen.
Correct.
Then he said that if we agreed, he would introduce us to the school principal. We went along and noticed that school principal was from Sepah Danesh School Services. The children were sitting there, had book in their hands, and I was so surprised. Little girls, little boys were sitting there in front of the blackboard and learn to read and write.
Please explain more to us how these clinics came to be.
Yes.
Please
Yes.
explain.
Yes, this is a very interesting question. As I had here at the time, the villages were told that if you make a building available to the state, the government sends the health service there. Also, the village was small. The mayor was very smart. He has built a new modern clinic there, and the government has provided him with the health service. The next day, we started receiving the patients. About 80 to 100 patients were there between 8 to 9 a.m. We started at 8 o'clock. The mayor required 2 reals from each patient so that they do not come uselessly to get medicines. 2 real were for the
Was so
operation
cheap.
cost of the clinic. One of us physician assistants was in the pharmacy. The other administered injections according on the doctor's wishes. I was in the pharmacy for a while, responsible for the doctor's prescriptions. You cannot imagine the medicines were distributed back then were first class, and some still exists today. I don't want to name and advertise, but the medicine were really first class.
As you said, yes,
Yes.
all services were free,
Yes.
including the medication and everything.
Yes, indeed, for free. It was given to people, even thought they were not cheap. Yes, were not cheap.
Remember what the cost was for the medication in clinics?
Yes, it was like every 3 months we received 60,000 tuman worth of medicines. Do you know how much my salary was? My good monthly salary for this village I chose 150 tuman. Yes, we lived
Good life.
with that money at that time. Besides the medicine for 60,000 tumans, the doctor had a budget for additional medicines. He sent the driver to Torbat Jam to get the additional medicines. That the for the patients.
There were extra cost for the other things.
Yes, and everything was free for the patients, and the syringes, everything was free. I wanted to tell you something interesting. People usually wanted the syringe to hurt them. If it didn't hurt, they thought the syringe was bad. Then the doctor said that we needed to inject vitamin C into the vein. For such people, one should inject into the muscle on the Botox. After we injected this into the muscles, the patient wasn't able to get up from the bed, but the patient was thrilled because that had in the effect on this illness. Once a moped rider came in the night and told us that in another village a patient has back pain. We went there. The doctor gave him and injected in the back and said, if it hurts you, it's good. If not, you have to go to the hospital. The patient received the injection and said, Doctor, thank you very much. I feel so good. So psychologically,
Yes,
it
yes,
had an
yes,
effect.
all right.
In any case, we have served people day and nights.
It was very good that people were also involved.
Yes.
Buildings
Yes.
were made available,
course.
and there were many
Yeah,
such
yeah.
relief that it was throughout of all of the Iran.
Yes, I have read. I don't know exactly. It was about 2000. Always
exactly.
one doctor, 2 doctors, assistants, and a driver. And every 2 or 3 days, we had to go to another village. We took medicines, our injection equipment, and drove to another village. There, the mayor called the patients together who stood in line and knew that we were coming so that the doctor could examine them. At the time, there were not one-way syringes. We boiled in water the part of the syringes and the needle in a container. Then we put it together with tweezers, and since the water was full of salt, we had to give
citric acid.
citric acid to water so that the salt would not clog the syringe. We were in the village, and I realized that I forgot to take tweezers with me. Then I told the doctor and mayor about it, and the mayor said, no problem, another Mr. Doctor is there. We asked, and maybe he has tweezers. We found the doctor there, and I said, Doctor, look for the ampoule. I forgot the tweezers. Do you have anything like that, the to lend to us. Doctor said, look, I have shovel and pickaxe, only tweezers I don't have. He was from Promotions Corps or Persian Sepai Tarvij ve Abadani.
As you told,
Course.
you were three groups. One group for
medical,
health,
yeah,
another for education, and the third for farmers and construction.
Yes, also for cattle breeding. Since this village where we always went was much smaller than our village, it had for the education and agricultural compulsory service for them. So we helped the people a lot until we were told that there was an outbreak of cholera or some another disease in Afghanistan. The border was closed and we had to go there to help the travelers from Afghanistan who went into quarantine. They were tested, so the tourists were allowed to travel to Iran again. Imagine that health
okay.
service gave us a film, projector and screen so that in the evening we can show a film to the villagers how the people to wash their hands, boil water and etc. so that they don't get infected with cholera. Imagine that
Alright.
we had to drive from one village to another at night
Educational
showing
film.
educational films. That was incredible and a great help for two people. Then we were sent to another clinic in Birjand and another group took over our clinic near Torbat Jam. But before that, I would like to tell you something incredible about something happened in the clinic near Torbat Jam.
Okay, I wanted to ask you that the story take place after the break. We will come back to you with all of the viewer. Once again, I welcome you. Thank you for being with us. Here I ask dear Humayun to continue narrating.
Thank you. After our work was finished at the Afghan border, we came back to our clinic near Torbat Jam. Patients came day and night. A mother came with a baby with burns. The baby has fallen into an oven. There it was, so that woman made a bread dough and put it on such a baking pad and put it in the oven in the floor. The baby was sitting on the mother's lap and falling into
Yes.
the oven. After the mother brought the baby into the
Now our friend in the
yes,
regie show us
Yes.
in the map.
into the clinic. The doctor took care of the baby, but this child had to have his bandage changed 3 or 4 times a day. The
So
doctor have
difficult.
had so many patients that he couldn't move. If so, then 20 to 30 patients would have had to wait.
As I remember, this event was a foundation
Yes.
of a new idea for you.
Yes, true.
This baby's burns and
Yeah,
your
yeah,
help was one reason for this.
Completely right. Yes, that was a very important idea that later took root in Europe afterward. You see a small suitcase in my hand, and because I didn't have a driving license, so I borrowed a donkey from the neighbor. Look at the saddle. Look.
I explained
Yes.
this picture was a C
Yes.
doesn't have a good resolution for you, but the viewer can see it in a better
Yes.
resolution in the
Yeah,
home.
yes, definitely during the lunch break and after work in my spare time, I was on the road and took care of the child. Fortunately, the baby fell into the fire with his bag. It was not very affected. Child felt then better, but if we hadn't been there, the child wouldn't have survived.
Of course,
Yes.
your group and your
Yes,
health
yes.
service saved this baby's
Wouldn't have survived.
life.
Yes, after some time, another group came there, and we had to travel to Birjan, to another village. Here you can
A new city.
Yes, here you can see Birjan.
Birjand.
Yes, there was, oh, yes, yeah, here you can see Birjan. There was also a very modern, large clinic built by the villagers.
The people helped for
yes.
building them.
Yeah. Here you see us, two doctors, assistants. I'm sitting in the back, doctor, Bijan, my colleague, and the driver. Yeah, it's an interesting story. The roads were very hilly. The driver who cooked for us saw a deer on the road. Wow, the would be great. Let's go and catch it. And so we chased this deer by car. He wanted to run over this deer so he could take the meat and to cook it. We almost fell into a ravine. The deer knew its way and knew how to run away. It was very fast, faster than the car. The doctor said, leave it, let's go to the clinic in any case he saved us. Then we were in the new clinic until we were told that the disease had broken out in Kurdistan and that we had to vaccinate the people there. We were sent towards Sanandaj in Kurdistan.
I asked the regie, please show us in the screen. Please.
Yes. Sanandaj. Each of us got from health service horse between villages, was mountains and no roads. No car could drive there. In Sanandaj, Kermanshah, my friends Qasem and me were given horses. This time there was no doctor with us as we only had to vaccinate to PT for his time. We were sent an interpreter for Persian to Kurdish. The health department has also provided us with an employee. My friend Qasem was very interested in Western movies and John Wayne. He quickly rode to my horse and beat it with the whip to make it jump and run away, and that in the mountains. For our loads, we were given a mule to carry out loads. I then loaded the loads onto the horse, and even I rode very, very slowly on the mule. It was safer, and so we had fun in Sanandaj. And there, as you can see, we vaccinate. It was very good. Yes.
How did people behave?
Yes. They all ran away when they learned that we were coming to the village. They had been afraid of the punctures. They didn't know how important it was. You see here the father of the child up there. The mother is watching. By chance, we found them. In the stable, we took out the people, yes, of course, who were hidden among the cows and donkeys, and vaccinated them.
For this vaccination, you have had to census for your insurance or
yes,
not?
we were told that from each village, 80% of the inhabitants had to be vaccinated. Then we could leave it. We wanted to finish the work in a village quickly, then back again on a house while we wrote with brush and paint that we received the number of vaccination in the village because of control on it. Because of the control, I told you. there is no paper for them. After this vaccination, we were back to capital of Iran, to Tehran.
Tehran. Thank you for your
Thank you.
explanations. We will take a short break and we will back. Dear viewers, thank you for being with us. We will come back to our program with Mr. Sodeifi. These sweet memories are important and unforgettable. They are very interesting memories from the 40s. There are incredible services of that time in the villages of Iran. For those who were not insured, our time is not enough for further narrations from the Mr. Sodeifi. I would ask you if you have something specific or special to say. I would be so grateful for hearing.
I especially wanted to dedicate this program to the Iranian people because this is a very important and great memory for me. And secondly, the idea that came from the baby whose bandages I had changed and whose wound I cared for because the doctor did not have time. In 2014, I read about the shortage of doctors in the Austrian newspapers, and that's when I started this idea. I wanted to digitize this mini case that I had in my hand. So that the doctor's assistant take it with internet and video and etc. and goes to the patient, where the doctor stay in the office and then says do this and do that, and the doctor's assistant follow his instruction. We will make a new video about this and make it available to friends. Interestingly, in April 2015, I found a large German company at the trade fair in Germany. I told about my idea, and in May I received an email from authorized signatory and chief financial officer of this company. Mr. Sodeifi, what's the idea? We have to come to Vienna and talk to each other, that the doctor's assistant do such work, and what happened. We will come in the next video, which is very interesting. This is idea will spread all over the world 100%.
Thank you so much, and
Please.
thank you very much for being
Please.
here and for telling us
Thank you
about
so
your
much.
good memories.
Thank you.
Okay, dear viewers, we are at the end of the program, but before we say goodbye, I wanted to ask you to be with us for more memories from Mr. Sodeifi's further, and surely more information like that baby will be the causes of hardware and software, the health services, or in Persian خدمات درمانی in Farsi will be offered to the people in every places of each country in the world. How to reach us, please see below, and you can be in contact with him. If you have pictures from back then, you can also help and then get in touch. And here I leave you and wait for you in the next program. Goodbye. Thank you so much.
Thank you so much.
Thank
Thank you.